Hey, what's up, guys? So, with all of this coronavirus going around, COVID-19, whatever else you want to really describe it as, there's a lot of issues going on with hospitals all around America. And now that there's more cases popping up at Indiana, which is a place that I live, and more specifically, probably like 30 minutes away or so, I want to be able to give as much back to the hospital that's local as possible. So here I have, as you can see on my face too, 3 very high quality grade masks. These were used in lime factories, chemical plants, stuff like that. So this apparatus right here, it's basically got a double filter and they're very good quality. I'm going to donate those. I know 3 masks might not be a lot, but those 3 masks might be able to save some of the doctors back there. So that's a thought process I had going into it. Now, I'm going to do things like donate gloves. I'm going to try to donate hand soap, sanitizer if I can find any, but I doubt that's possible. So this isn't for money, not anything like that. It's going to be for a message, and I'll talk to you more about that at the end of the video. I'm going to get out and get going to go pick up my sister. We're going to do some running around, get the supplies, and I'll be back in a little bit. So guys, one other thing I forgot to mention is that I'm also going to be donating a box of gloves. Those around my area, which is up in the northern part of Indiana. Sorry, I was going to say Illinois, but Indiana. Gloves out here are scarce. So I just took a couple pairs just to have for myself, but I'm donating about 60 pairs of gloves to my local hospital along with those masks. Like I said earlier, I'm going to try to donate as much antibacterial hand soap as I possibly can because I don't know if they're running low on that too, or just hand soap in general, because I know the sanitizer out here is really starting to become a big issue. So if I can get just any sort of hand sanitizer, hand sanitized soap, or anything like that, I'm going to do my best. And sorry, I'm driving. That's not why I'm looking at the camera. But I'm going to do my best. We're going to see what happens. And hopefully we can make some people's day at the ER in terms of the doctors, the nurses, etc. So again, when I go pick up all of the other stuff, I will talk to you guys when we get to the stores. So see you in a couple seconds. All right, so just got confirmation from our local hospital. The donations are a go. We're outside right now, just trying to hit up a couple of places, try to get some more supplies. My sister Abby's helping, so I'll put her information down in the description if you guys want to go check out her photography or anything like that. And with that being said, I will talk to you guys when we reach the hospital. Don't try to stalk me now. Don't do that. And remember that this is specifically for the fact that if you guys have supplies that you're not going to use, or if you have an overabundance of supplies. I know the thought of like hoarding it or saving onto it just in case is huge. But hospitals need the help. They're the ones that are taking care of the people that are going through this crisis. So the more that we, as I guess a society, can help them, that's beautiful. And the person that I talked to, his name is Jason. Sounds like a really good dude. He's one of like the heads up at my local hospital. And when we said what we were going to do in terms of the donations, he sounded elated and kind of relieved. So the more difference that you and I watching this video can make, then I think we can provide more good to people that need it. So with that being said, I will talk to you guys when we reach the hospital. And she wanted to say hi as well.
One more thing as well. Even if you can't donate, a lot of people just want the thank you. Like the medical workers, your grocery staff even. So they really appreciate if you say thank you or like, hey, doing a good job. Yeah,
so in terms of like your local hospitals or hospitals that are in like New York, California, Louisiana, Virginia, because I know they're starting to get a lot of the cases as well. Here in Indiana, it's not so bad. We maybe have like a total of
like
50 to 100, maybe 150 cases, but a lot of them are locked down, quarantined, and Indiana's doing an like overall good job of doing this stay-at-home curfew thing. So just give thanks to people that need it at this moment and give hope to people that need it as well. Those that are going through the disease, those that are grieving from losses of family members to this disease, they need to hear thank yous for what they have done. So thank you guys. But again, when we get to that hospital, I will talk to you guys then. So see you in a couple seconds. All right, so trip one down. I know I said I was going to pick up with you guys when we got to the hospital, but we just got the supplies as much as we could anyway. And here is our total surplus. So would you be so kind to tell us what we have?
So we now have 14 like bags of gloves in one box. We have 3 masks, 12 things of like little hand soap, a pack of like reusable sponges, and then 3 big packages of tissues, and then 2 smalls.
And just throwing that out there, we got it at a place called Dollar Tree. If you have them by you at all, try to get as much there as you possibly can, whether that's hand soap, antibacterial soap, cleaning supplies, gloves, anything. Right now, they need the most help, so let's just do that. So we're gonna go to one more place, and then we're gonna hop into when we get back to the hospitals. So I'll talk to you guys if we can find anything at this new store. If not, we'll be at the hospital. So thank you for watching this so far, and stay tuned. All right, guys, so one more update before we finally hit the hospital. We're on the way there now. We picked up more supplies as well. Picked up a lot of antibacterial soap since we were able to actually find antibacterial soap. We got a lot of cleaners so they can, you know, spray down their floors and while they mop and all that, so that's good. We got a lot of toilet bowl cleaner because you know how obviously hospitals are. If you're there, you're not there for a good reason. So that will help them, hopefully. And I just really hope that this message or this video can actually send out a good message of just trying to help other people while you can, or if you can. So that's the main reason to do this. There's not going to be ads on the video or anything like that, so that's going to be absolute bullshit if you think that's the only reason why we're doing this. But this virus has crippled a lot of people in more ways than one, whether that's supplies, finances, jobs, anything, you know, health. So if we all just kind of put our minds together, try to get that one goal in terms of trying to help people as much as possible while we're permitted to, then I think everybody that watches this video should just take into consideration of trying to help someone else as well. And the reason why I keep looking up is just to check the road for my sister, who is currently driving right now.
Can I say something as well?
Yeah, go ahead.
Even if you can't get supplies to donate, there are other links as well, or other resources that you can find, that like little projects you can do, like making masks for these people as well. Because I know a lot of supplies is also very, very scarce at the moment. So I can like send Eric links and everything if you want to include them.
Yeah, so like she was saying, I'll put the links down in the description. I'll try to find out some other places that if you can't go out and get supplies for yourself, that you can donate to places like maybe Red Cross, stuff like that. So there will be stuff in the description to donate to if you'd like to, but if you can like provide supplies, that would be even better. If not, I know they can use the money and they'll put it towards doing something good to help the people that are going through this terrible time. It'll help the people in the hospitals, it'll help the doctors, the nurses, the patients, everybody. So the main message to get to with this video, just try to help people. Just try to be as positive as possible, and I know we'll beat this. We'll beat this. It might take a while, obviously, but we'll beat this. So just keep the hope up. And after we drop off the supplies, because we are coming up to the hospital now, and I will show you just the outside of it, which is going to be right around the corner here. So give me a second. We just ran over some gravel in the road, which that's always nice.
There's the hospital.
But there you go. So we're going there, and we'll be dropping off the supplies. So we will talk to you guys after we drop everything off. So be right back. Well, ladies and gentlemen, so this will be the last time you hear from me outside, because I do have a little bit more I want to put at the end of the video, a little bit more of a sincere message as well. So I will catch you guys when we talk to that. But the supplies have been delivered. I wish I could have got it on camera, but unfortunately, obviously, due to HIPAA violation, I don't want to do that. I don't want to get arrested, or I don't want to put other people's personal information in jeopardy. So their eyes lit up though when we donated all of that.
They were very, very happy.
So if you guys can do that, that would be awesome. But I will talk to you guys when I get back to my house. And now, guys, very quickly before I actually get into the final message, this is just to show the receipts of everything that we donated.
showing that we actually did purchase what we went out and said that we did. I know a lot of people are going to be skeptical and said, oh, you didn't really do that, you just took it home. No, I wouldn't fucking do that. So as you can see, bought a lot of things besides that cherry Coke. I was just thirsty. We bought a lot of different like soaps for them, like Kleenexes, reusable latex gloves, which is something that they're really, really short on. So that was huge. And this is the one that I ended up buying. My sister bought some as well, and she'll actually show you a different receipt for that too. And as you can see, 3/31 of 2020 at 8:20 a.m. Now we're going to go over to the next one, and I scratched out all of like the personal information because I don't want you guys going after like my mom or anything like that either. My sister had to use her card, but there's all the like Kleenex, there's a lot of different soaps, there's a lot of different gloves, etc. Sponges, because they need sponges as well, just to be able to like clean floors and whatnot. And then the final one here, which is only a store that's in Indiana. It's basically our local grocery store, so I'm sure there's a lot of different ones from every different state.
It's like a Publix or like your Costco, not Costco, like a Kroger.
Yeah,
like that.
Yeah, stuff like that. So as you can see here, this is what my sister bought. She bought a thing of antibacterial soap. I bought one as well, and I think that's all that I bought. And then she bought 2 things for them of toilet bowl cleaner as well, because as I mentioned earlier, you know how toilets are with hospitals and how much they get used there, both in a good way and in a not so good way. So I think they would be able to use that as well. So again, let's see. Yeah, 3/31/20. So just wanted to show you guys the receipts.
And as of right now, it's currently March 31st, 9:49 a.m.
Yep, you are right. So be right back, guys. So as I mentioned, guys, this video is going to be a first vlog. I'm probably not going to do this again for a while, but this whole COVID-19 issue, pandemic, whatever you would like to classify it as, it is really, really fucking serious. And a lot of people are still downplaying it. And I know I'm not going to get on here and preach or be political or anything like that. All I want is to try to bring a lot of people together and try to help people that need it. So hospital workers, people like firefighters that actually have to go in and assist all of these people as well. All of your healthcare providers, stuff like that. If you have supplies at your home that you know you're not going to use, please consider giving it to your local hospital or your local doctor's office, whether that's gloves, masks, cleaning supplies, because they can use a lot of that. Even like those rubber latex gloves, they'll still work. Or antibacterial soap or anything. Just anything. The more we can give to them, the better off that they'll be. And I know it might not reach a lot of people. I understand that. And especially with this being a vlog and nothing to do with gaming. But as I've told you before, I want to use this platform as a beacon of hope. Whether that's for like the mental health side of things that I normally make videos on, or if it's in a situation like this. I want to give hope to people out there that are suffering from this, or have family members that are suffering from this, or are seeing people suffer from this. Thankfully, where I'm at in Indiana, we don't have too much in our specific area. A lot of our cases are down south and maybe around Indianapolis and further south than that. Although there are a couple creeping up towards us now. So here, we're okay. I know places like New York, California, Louisiana, now Virginia, I know they're getting hit hard. And we just need to try to help them out as much as possible. Remember, we're humans. We need to go out there and try to help other humans. Selfishness is not going to help the situation. Selfishlessness, I don't even know if that's a word. I made that up on the spot. But not being selfish, helping people, that is going to bring you more joy. And I would say if you're going to go out and help people, obviously be safe for yourself, wear a mask, bring sanitizer, wear gloves, do whatever it is that you have to do. As you saw in the videos that I recorded on my phone, I'm sorry if the quality didn't come out too well in terms of my voice, but That's the only thing that I have to record. I don't have a camera, so I'm making do with what I have. But you could tell I was wearing a mask. My sister, she was wearing a mask. We didn't even really go into the hospital that far.
We just kind of walked into like the waiting room.
Yeah, we walked basically into the ER or like entrance, and they have about 2 or 3 people watching that door.
Mm-hmm.
They're wearing full masks and all that, and I can understand why. And unfortunately, as I mentioned on Twitter, I mentioned earlier, I could not go inside and record, obviously, because of a law called HIPAA. And that is just to prevent, obviously, information from getting out. So, like, doctor-patient confidentiality, we didn't want to jeopardize any of that because that is a felony.
That's
and I don't want to go to jail for that. I'm trying to do something good, not break the law here. But this message and this whole video was just to try to bring people together, try to give people hope. That's it. If you don't like the video, I understand because it's not related to gaming, but this issue is bigger than gaming because
Gamers
people need it. People actually need help. And if this can be somewhat of a spark or just something, I know myself and my sister, we did our part in trying to help that. And if maybe this video will reach somebody, maybe they'll go out and help. Maybe other people will go out and help. And just start a chain reaction because we're in this together as the human race. It's not going to distinguish from that being the virus. It's not going to distinguish from race, religion, sex, sexual orientation, like poor, rich. It's not going to distinguish or differentiate who it attacks.
Look at
So-
all those celebrities.
Yeah.
All the people who can't even afford health insurance that are getting it.
Exactly. It's not going to distinguish who it goes after. The fact that it's going after people. We, as human beings, need to help other human beings through these terrible times. So, if you can do anything to help, please do so. If you don't want to go outside and jeopardize your own health, I completely understand. There are other ways to help. You can donate to things like the Red Cross. You can donate to other things that will be in the description below. Or if you want to do something, and if you know how to sew masks or actually create masks or anything like that, that's the perfect way. She's going to actually provide a couple of links for me that I will put down in the description as well. But the main message here is we're all in this together. Let's just give hope to the rest of the world. So, with that being said, thank you so much if you watched all the way through. And this will pass. It's going to take some time. It really will take some time. But it's going to pass. Just listen to what people are saying about the whole social distancing. I know we're both perfectly healthy.
Oh, we're kind of breaking that, so go away.
But we're-
6 feet, go away.
I'm the one making the video, but we're perfectly healthy. We're not sick. And shut up. It's not something to joke about when I'm trying to make a serious video.
I'm sorry.
But like I said, if you're gonna go outside, make sure you're at least 6 feet away from people. If you're inside and you know everybody's healthy inside, that's fine. But
If
just
you have
make sure.
symptoms, please keep yourself isolated, keep yourself safe.
And if you have to go to the hospital, call beforehand. And make sure you tell them the symptoms, tell them everything so it gives them the opportunity to get ready to see you. Other than that, just keep yourself safe. If you're going to go outside, make sure you're wearing a mask. If you're going to places like a store, Walgreens, or a gas station or anything like that, sanitize your hands, make sure you're washing them all the time. And just try to take all the necessary precautions that people are telling you to take. So, the biggest thing, I know it sucks for a lot of people, but stay home. If you can stay home, that is probably the number one option to not spread this disease anymore. And I can't overemphasize that. You've heard it a lot. You probably heard it from many other, even bigger YouTube channels. Or you've heard it from all of the media going around covering it. You've heard it from all the doctors. Please, for the love of God, listen. Just listen. Let this thing go. Let it run its course. But stay inside. Do not make this worse for healthy people. Do not make it worse. Because the more that you're not going to obey by the rules, the more people are going to get that, and the longer we're going to get in a lockdown, and it's just going to be a continuous cycle. So let's just try to break that cycle. So please, keep yourself safe, keep everyone around you safe, and we will be okay. As I mentioned earlier, it will take time, but it will be okay.
And as a little side note, for those who are struggling with mental health, and this is really affecting you hard, like depression, keeping yourself isolated, it will get better. There's many ways to cope with it, finding new hobbies you can do, texting friends, keeping yourself very busy. I get it. So
Because she's there for me when I'm dealing with my stuff.
he's there for me when I'm dealing with mine.
Yeah, we both deal with mental health issues. So if you guys need to talk to anybody, contact me. My DMs on like Twitter and Instagram are always open. If you're dealing with something, please contact me. Reach out to one of your loved ones. If not, I'm going to provide even more information and links down in the description for you guys to go check out. That will help you out a lot through these tough times. I promise that. But, sorry, if you want to keep it confidential and talk to me about it, I'm always available. Just DM me on Twitter or Instagram. The only time I won't respond is if I'm sleeping. So just give me a couple hours. If I don't respond, I'm sleeping. But I will answer it the first second I get the opportunity to. Sorry, I didn't mean to cut you off.
I'm also available on Twitter. It'll be in the link in the description. If you're not comfortable going to him, he's a bit older, a bit younger. So like you're
15, so
younger viewers. So I'm here as well.
So we're here for you guys. Just keep that in mind. But if you don't want to talk to us or anything like that, completely understandable. Make sure you just reach out to someone that you know, you love, and you trust.
Mm-hmm.
And hopefully, if it gets to the point where it's to the extreme, maybe you can get some help by going to a doctor. I know a lot of them are busy, but in terms of mental health, you should be okay just going to that facility. So,
and there are also very good online therapy places that are starting to open up because of the demand of wanting to go.
Yep. So we're going to try to provide as much in the description of this video as possible. And if you do end up donating to your local hospitals or like Red Cross or anything like that, and if you want to share that with me, that would be awesome. If not, thank you. Just thank you. Not only for me, but all of the medical staff and all of the first responders and all that. And I'll leave you with one more thing before I go. And this is something I put on Twitter as well. After we dropped off all that supplies, which was almost $60 worth of supplies, I know it doesn't seem like much, but thankfully Dollar General came through with that.
So much.
And we bought about like $30 worth of supplies, whether that's reusable latex gloves where they can continuously, sanitize them and use them over again. We dropped off about, I think, 4 masks? 3 or 4 masks?
Yeah, the ones that we had.
Yeah, very high quality masks that they can use for extended periods at a time. We donated a lot of like antibacterial soap, a lot of like floor cleaner, a lot of like bathroom cleaner, stuff like that, and they were elated. Mm-hmm. I talked to one of their like quote unquote general managers, if you want to call them that, or I don't even know if like the managerial system and how it works in a hospital, but I talked to him. It was a guy named Jason, and my sister had him on speakerphone, and he sounded so happy and so like relieved that he was finally getting supplies. When we walked into the door, the 2 like aides that were at the door, they were so happy that we were donating all of that. So not only are you making the days of the people at the hospital, you're making the days of people that could actually use the supplies that we're giving. So again, I know, I'm sorry, I'm done with the rants and the tangents, but it just shows that it gives other people hope and it gives other people happiness, and that's what we need right now. We don't need to keep going on social media and seeing all of the negativity. We need to hear more positivity about like maybe people that have recovered or people that are donating and making other people happy, giving other people hope. We need to give more hope to people out there rather than all of the doom and gloom that you see on social media or on TV or anything like that. And I wanted to do my part, so I'm going to leave it at that. If you guys enjoyed the video, let me know. I won't be doing another vlog. I'm not really comfortable with a camera yet, or with my phone camera or anything like that. Maybe in the future, if I can, save up, get a good camera. But as of right now, that's not a priority at all. Mainly helping people, trying to get you guys through this quarantine. I will explain why I haven't uploaded, but that'll be in a different video or the live stream tomorrow. I'll explain all about it. But I just wanted to let you guys know about everything that's been going on my mind here, just trying to help people. So with that being said, Thank you all for watching. Hopefully this sends a good message out to the world. If you see this and want to have other people help as well, there's not going to be any ads on this video or any of that bullshit because I don't want to profit off of this. I don't. I want to just send the message of hope. So there will be one favor though, just one. And I did put that on Twitter as well. All I ask is just to share this video. That's it. Just share the video. Let other people know as well. So that's it. So from myself and my lovely sister Abby, we wanted to say thank you, and we will talk to you hopefully in another video because I have a plan with a video for her. You guys might be interested. So see you later, guys.